If this isn't enough, a few extra fun facts about Dr. Molina. He has 3 black belts and a senior master, a 7th-degree black belt in the Filipino martial arts. He has also directed several films. Aside from this, he is also a classical pianist. Please join me in welcoming the 2022 Speaker of the class, Dr. Oscar Molina.
Thank you, Dr. Nagy, for a very generous introduction.
Okay, but sit here in front of you.
Dean Srihari, members of the faculty, Dr. Kasami, class of 2022, ladies and gentlemen, good afternoon. You guys look great today, by the way. Can you believe we're here? Well, it seemed like yesterday when Dean Srihari was welcoming us with the words which I could never forget. He said, "Welcome to the flagship executive program of the flagship university of the State University of New York." And I would always think about that. And for the past Saturdays, for the past year, getting to meet every single one of you, sharing food, sometimes being a little more excited when the food is a little good, and listening to all your dreams and aspirations, and seeing how Dr. Kasami would be at the back of the class, even though he wouldn't be teaching. We had how many graduate assistants? We had like every other week. We had Biraj, we had Roya, we had Ragad, online. Aside from Asil, Aisha, where's Aisha? Aisha would also be there. We had a whole army supporting us. Imagine that. And if people would think, for one person to get quality education, you need to go to the private sector. Binghamton University and the department has proved that public education could indeed be among the best of the best. And you all are indeed among the best of the best. And I am so proud of all of you. Many times there comes a little bit of confusion when it comes to the program and what we are studying. The beauty of the program is you do not have to be engineered to study this. And one thing which you would come across is all of us have different degrees. If you come from a medical background like me, you would have an executive degree in systems science. If you come from an engineering degree, you would have an executive degree in systems engineering. And of course, for our industrial engineers, you would have an executive master's degree in industrial engineering, and we all have a concentration in health systems. And oftentimes I would find myself explaining to people what it is which we actually study. And I have this joke which sort of brings you into the mind of a systems engineer. So for all illustrative purposes, I would be using the term systems engineer. Just keep in mind that I am referring to all 3 degrees. So a mathematician, a physicist, and a systems engineer were all given 3 identical rubber balls. So they were told they can have anything they want and all the time they need, and all they have to do is to calculate the volume. So the mathematician, he gets a rubber ball, he measures the circumference, he divides that by 2 times pi to get the radius. He cubes that, he multiplies by pi again, and then he multiplies by 4/3 and thereby calculates the volume. So the physicist, he gets a bucket, he fills it with a gallon of water, and with a rubber ball, he drops it in the gallon of water, and he measures the displacement to 6 significant figures. And the systems engineer, he gets the rubber ball, he sees a serial number, and then he Googles it. And that's what we call process improvement. Forbes magazine came out with an article recently hailing engineers as the unsung heroes of the pandemic. Of course, we've heard about frontline workers, we've heard about doctors, nurses, public health specialists, and researchers. But for systems engineers, they have made valuable contributions to process improvement, of course, which isn't just looking at the rubber ball and Googling it, but to supply chain management, data analytics, dashboards, and mobile apps. And with 1 million Americans dying of COVID-19, what was initially thought as the great equalizer, it easily proved that long existing inequalities which have affected immigrants and Black and brown communities haven't been addressed. And for us systems engineers, this is an indicator of a system which needs streamlining. Learning from the mistakes of the pandemic moving forward, we need to engineer systems which enhance collaboration and leadership among the various public health agencies. We need to engineer systems which provide a continuous stream of finances, which meet the need of the communities. We need to engineer systems which provide a way for real-time data exchange so that the response can be accurate and real-time as well. And of course, we need to engineer systems which help combat misinformation so that we can rebuild public trust. Sir Arthur Conan Doyle has a fictional detective known as Sherlock Holmes. Of course, for those who have read the novels and seen him on the silver screen, he has awed us in the art of deduction. But for us as systems engineers, we understand that deducing is linear causality. As amazing as it may seem, he looks at the effect and deduces it to the cause. For us systems engineers, we deal with complex causality. So that means we're better than Sherlock Holmes. And many of society's current impending problems which have seemed to come back again and again are complex systems. Everything from inflation, the opioid epidemic, disease outbreaks, homelessness, mass incarceration, mass shootings, racial violence, bigotry, global warming, healthcare, and mental health, these are all complex systems. And for us to understand complex systems means we have the key to society's plaguing problems. And combine this with the fact that Kahneman and Tversky's Nobel Prize winning theory called prospect theory. It says that we are terrible at making decisions based on our biases. And this is the reason why the American Medical Association, which Dr. Kasami mentioned a while ago, heralded health system science as the third pillar of medicine. Imagine among any country in the world, we spend the most in healthcare, per capita, per GDP. But why do 37 million Americans have no insurance? And 41 million have inadequate insurance. And this does not even include the undocumented immigrants, who most companies rely on for manual labor. That's why in 2008, a far-right Republican and a far-left Democrat actually came together for the first time. They wrote an article entitled, "How to Bring American Healthcare from Worst to First." And in this article, they pointed to one institution, Intermountain Healthcare. A study by Dartmouth researchers in 2008 showed that if every other healthcare system in America would adopt what Intermountain Healthcare is doing, we would be able to decrease healthcare expenditure by 40%. And of course, we don't even have to look too far. Because here at Watson College, as mentioned a while ago, we have WISE, the Watson Institute of Systems Excellence. And WISE has been doing this for 30 years. We focus on healthcare and 5 other core issues, and all of these intersect. Remember, during the pandemic, we had shortages. We had shortages in masks, we had shortages in ventilators. And WISE has been working on supply chain management before the world understood what supply chain management is. WISE has had 750 contracts with 20 organizations throughout the country. We've had 150 graduates who work in healthcare from the WISE program and 125 from the Manhattan program. And its efforts in healthcare has saved hospitals up to $50 million. Imagine that. And not even to quantify the countless hours of processes improved, hundreds of Kaizen events, tens of thousands of processes improved. WISE's work with Live On New York, for example, has the potential to improve organ transplantations up to 1,000 a year. Imagine that. People wait years for an organ transplant. And this could amount to saving up to 700 lives. Moving forward, friends, let us never forget that we should not stop to ask questions. Always remember our 5 whys of root cause analysis. Remember during office hours, who's the person who keeps asking the questions again and again? Yeah, there she is. She's raising her hand. Victoria. And sometimes she would apologize. And I remember Lenny telling me, we just have to sit there, listen to Victoria, ask the right questions, and we find the right answers. And the same is with life, friends. Ask, and you shall receive. I remember in class, Conrad would ask again and again and again. He would never stop asking. And most of the time, I would have trouble as well, because it's hard. What we study is hard. And I remember looking back and seeing Shri beside him and saying, I'm glad you asked that question. Because I'm not understanding a thing. And Shri said, we're all in the same boat now. We're all here to learn. So we should never be shy of asking questions. And Victoria, never lose that inquisitive nature of your lives. Because life's biggest mysteries will be open to those who ask. Number 2, in the spirit of Kaizen, you must constantly improve, constantly learn, and constantly evolve. Quite some time ago, in 2007, there was a mobile phone company known as Nokia. I don't know if you guys are familiar with it. but in 2007, Nokia had 50% of the market in mobile phones, but none of that was in smartphones. And they failed to recognize the shift into smartphones, and now we don't know. Most of you guys don't know what Nokia is. There's a time when Blockbuster, in the 1990s, they had 9,000 stores throughout the country, 84 million employees all over the world, 65 million registered customers. But where's Blockbuster now? They failed to recognize the impending shift in consumer demand. And in 2010, they were overcome by Netflix, and now we all watch Netflix. Number 3, remember, we have the power to predict and create the future. I remember Lincoln once saying, the best way to predict the future is to create it. But that's a safe statement, because Lincoln was not a systems engineer. For us systems engineers, we have the power to predict and create the future. Imagine the next pandemic. We can predict that. We have forecasting analytics. We have predictive analytics. And with great power comes great responsibility. Number 4, we have to be good communicators. I remember I was in a group with Florence, and the moment she sat down, she said, guys, we have to do this on mental health, so passionately, so adamantly, and we had an amazing design thinking project on mental health. I remember Sandy passionately talking about Mark Cuban's cost plus drugs. Now, cost plus drugs aims to it aims to disrupt the pharmaceutical industry. Abacavir, for example, which is a drug which is used to treat HIV/AIDS, is currently retails for $1,000. Cost Plus Drugs sells it for $50, taking out the middleman. In 1988, the World Health Assembly was committed to eradicating wild poliovirus. And by the year 2000, they were able to bring cases down to 1,000 a year, which is amazing. By 2002 to 2003, they were having financial problems, so they said, okay, let's focus on endemic countries with very high cases. But in 2004 to 2005, because of that decision, countries who were previously polio-free started to have polio. So in 2006, the WHO director called a stakeholder consultation, and Thompson and Tevins were able to present this model. So there are two options, option 1 and option 2. The first option is total eradication. So you focus vaccination efforts until you totally eradicate it. Option 2 is you focus vaccination efforts until you bring it down a bit, but then you would have a second wave. And then you'd vaccinate again, and then you would have a third wave. And then it would come again and again, and this seemed kind of familiar because it kind of does. So guess where they went? Of course, they chose option 1. They renewed their efforts. There were hundreds of millions of dollars, which was committed again for total eradication. See, the thing is, friends, our models are only as good as how we communicate them. And finally, remember, there is strength in our cohort. I remember Michelle once joking. She was joking around, saying, "Oscar, don't forget about us," you know. And then the thing is, as a cohort, in the words of Helen Keller, alone we can do so little, but together we can do so much. And Byron sort of encapsulated this when he said, "Hey guys, remember, wherever I go, you have a friend in me." Actually, right now in the job which I'm applying to, there are other several vacancies. If you guys can work there, it would be great if we would work beside each other. And that in itself is the essence of the strength of our cohort. Once in a while, Liam would approach me. He would say, "Hey guy, Oscar, great report." I would tell him, "Yeah, actually, it's a little nervous." "Yeah, I know, but it's still a great report." And things like that, they're so simple, but they can actually go so far. And the same as how physicians would consult each other, they would ask for second opinions. We should never hesitate to ask for help. I know I could always approach Shannon Wall or Shannon Lee, who, by the way, are an amazing graduation regalia today. And that is how we should rely upon each other. Shakespeare once said, "The miserable have no other medicine but hope." And studies have linked the loss of hope to lower life expectancies. I currently work at the New York City Department of Health, and health disparities between different boroughs could go as high as 10 years. Imagine that. And this brings about the geography of desperation, the loss of hope. But now I am seeing the light at the end of the tunnel, and that is in a systems changing work, which we are all about to take part in. I am so proud of all of you. Congratulations, class of 2022. Remember, the best is yet to come.